I'm truly a general orthopedic surgeon. We do everything from, again, computer-navigated total hip, total knee replacement, sports medicine, arthroscopic rotator cuff repair, knee scopes, ankle scopes, fracture care, trauma. My father was an orthopedic surgeon. He's now happily retired. From early age, as long as I can remember, his pager would go off. As opposed to not see my father, I chose to go with him. So I was exposed into this world of fracture care, reduction, and patient management from early days. And back then it was very easy to even gain access to surgery. At age 10 years, I would be in scrubbing cases with him, holding retractors, and he was educating me from day one. So definitely had an early exposure to the practice, and saw how it evolved through the years with the technology, and it's always been a big interest. In regards to patient care at Sorce Orthopaedics, we have a very unique situation. I am not a hospital-owned physician, and I do not have other partners. I am a single solo specialist, which is a very rare bird in these days. What that allows me to offer my patients is personalized care based on what the patient needs, not based on what a hospital agenda or HR person decides or other overbearing senior partners decide. So when people come to this office, they get the care that we, the patient, myself, decide is best for their needs. And again, that's something that people have learned to appreciate and subsequently will travel to achieve. I'm not going to lie, it cost me a king's ransom to be able to practice medicine that way. I definitely am not the wealthiest orthopedic surgeon, but I'm definitely one of the happiest because of this freedom to tailor medical care based on the patient's needs. People really do appreciate that. They understand the value of medicine for medicine's sake. A lot of people, when they come to see an orthopedic surgeon, in the name is surgeon, so they think they're immediately going to get surgery. That's not the right fit for everybody. First and foremost, I'm a physician. If need be, we do have the ability to perform various procedures. However, surgery is a double-edged sword. It does cut both ways. There are inherent risks with procedures. Nothing is a quote-unquote cakewalk. However, you do get great results. But first and foremost, I never like to use the last trick in the bag. I like to have I like to keep a full bag of tricks. So what I tell my patients, I want to do as little for you surgically as possible, not because I'm lazy or I don't know how, but you know, life goes on. Already they're injured, that's why they're talking to me. So if I do the last case first, then they injure that, what's left? So we take that minimalist approach in everything from conservative treatment, and we give them what they need. And we always like to give people tailored care based on their needs and nothing more. Not because I know how to do something or because I have a little widget in the back room. If it's not a good fit, they don't get it. As far as overseeing my patient population, it's real simple. You're looking at the chief cook and bottle washer. I, with the aid of my staff, handle everything. Okay? We have a lot of information that we can offer the patients as far as written material. We have a lot of accessibility to the patients. If they ever have a question, they call. We never force anything. There's no agenda. We have no timeline to meet. We take as much time as we need or they need to explain each procedure. It's my personal goal that they should have absolutely no question before, during, or after any kind of treatment. It's very simple. We simply communicate. There's no red tape. There's no computer systems to worry about. It's just person to person.